And then when you read the same concept from the books, it gets really easy. And that's what most of the high scorers are doing as of now, as I know.
Yeah, because after solving MCQs, when you are reading the content, like it's been like what to study and what to just skip and avoid, because
Exactly.
you will get a just an idea after solving like 100 or couple of hundred questions. You will just get an idea that this will be asked, this will be not asked. So why to waste the time on this instead of study this only. How long does it take to prepare for you for step two? Like dedicated time, as you tell the step one. How long does it take for preparing for step two?
I think if you're doing it right within a month after giving step one, it might as well take you just 4 months. I've seen people clearing it in 4 months if they're taking in very close periphery to step one. But if you have a gap of, let's say, 6 months, like I had after
Mm-hmm.
step one, then you might forget a lot of information. Then it's almost like you're starting from square zero. So it
Okay.
might take, it took me 8 months for preparing in order to prepare for step two. But I think that delayed time was fact. A lot of things were factored in for that delay, like COVID, me clearing my FMG exam.
Yes.
So I think, but you can easily clear it within 6 months if you are right. Like if you just start right after your step one, probably after a month of gap.
Okay. 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 Yeah, because the knowledge and the concepts are like more
Yeah,
fresh. It's already you have the like buttered the concepts, and you are just building the management stuff over that concept, so it will be more easy, and it will be more easy and more fast for you.
yeah, definitely. You got the point. Yeah.
And what are the core resources that you use for step two, particularly for step two only?
For step two, I think that UWorld annotated book was I read that book extensively.
Okay.
And then UWorld, a lot of UWorld, like I did
Mhm.
UWorld probably 2 times before entering my step two prometric center. So mostly UWorld and UWorld annotated book,
Okay.
but I also used Step Up to Medicine. That is a book which I just read briefly some concepts from it here and there. It was recommended, so I just tried it, but I didn't use it extensively. The extensive tool I used for step two was UWorld and the UWorld annotated book, which is online
Okay.
in
Okay.
Drive files.
So was there any kind of like online resources that you use, like for step one, most of us use like boards and beyond, pathoma lectures. So was there any kind
I
of,
didn't watch any lectures. For step two, I didn't watch any lectures.
okay.
I probably use boards and beyond lectures here and there for difficult concepts like, nephrology and stuff, where you
Mhm.
need some nitty-gritty, basic, mechanistic kind of explanations. But rather than that, mostly 80% of my step two study was only based on UWorld.
You world and annotated book of your world.
Yeah, annotated book.
Okay, okay. And so the next step, most of us wants to know that what are like electives that USCs, because more there are different types of USCs, like hand-on observership, electives, and so many things. Like how to find them and what is the benefit of doing these USCs and electives?
See, basically, when you are done with your step exams,
Yes.
you are like, if you want to enter a match, if you want to fill in the eras application,
Mhm.
you kind of require some US clinical experience.
Okay.
And you divide US clinical experience into a couple of stuff. Like there are clerkships, which you
Mhm.
can only do while you are a medical student.
Okay.
And then there are observerships and externships of some kind, which you can do after graduating.
Okay.
Like once you're graduated, you no longer can do clerkships, but what you can do is observerships and externships.
Mhm.
Now, all these hands-on clinical experience that they're talking about over the internet,
Mhm.
everything comes under observership and externships. So all those hands-on clinical experiences, either observership or externship. Now, there are a lot of ways where people approach this journey. So there are a lot of agencies like USMLE Sarthi, there
Mhm.
is PMO opportunities, there's
Yes.
ACE MD.
Mhm.
So all of these organizations, they're good in the sense that they are providing you a physician. If you don't know anything, like if you're very noob in this journey, you don't know any American physicians, it is a good tool because it provides you a visa. It provides you a contact, real first-hand contact with a specialist, right? In the United States.
Okay.
And they also give you good letter of recommendations. Like you will not know how the letter of recommendations are, but you can get a first-hand experience in that sense. And then when you reach US, you can connect with medical students, you can connect with residents while you are doing that rotation, and they might give you some information, some emails of physicians, and you might directly apply to a university. Like your second rotation or third rotation might not necessarily be from those agencies,
Mhm.
because you can use those agencies as a portal to enter US because
Yes.
they're
Yes.
valid, they're
Mhm.
100% genuine. No doubts about that, especially USMLE Sarthi, because they have some really good physicians, which I personally liked. So, and they give me, I think they give me good LORs. Um, as from what they, told me during the interviews and during the rotations. So there are some university-based rotations. They are essentially observerships, not necessarily hands-on clinical experience.
Mhm.
But even those observerships can score you good letters and give you a first-hand experience of the American medical system. They have different working hours. They have different approach to deal with things. For example, here in India, they would just write you a prescription and then you are free to go buy those medications. There's no third person in between, right? In US, it's like you, without a prescription, you can just buy over the counter pills. But when you get a prescription, then the hospital directly sends the prescription electronically to the nearest pharmacy, and then you need to collect. You just, as a patient, you just need to go and give your like number, like your patient ID number or something like
Mhm.
that, and they would just give you the medications because they already know that you need this. So
Some sort of
that,
something different thing.
yeah, in that way you can basically avoid a lot of mishandling with drugs.
Uh,
That's why the system is in place, and that's like, it's like a physician ordered a medication, but then there is a pharmacist who, receives it on the other end, and you know just did a second, that what's the disease, and is the dosage right, is the formulation right, because a lot of times physicians can miss a lot of things, right? So it's like a second
Second
look,
opinion.
yeah, second opinion, second look towards the medication orders, and in that way the system is refined over there. So that was something which I didn't know, which I got to understand for the first time. Then there are some state prescription guidelines which you have to follow, especially in psychiatry kind of rotations where drugs are heavily loaded with adverse side effects. There's eye stop monitoring services. There was a kind of the service in New York which I didn't know about, right? Which was monitoring a lot of patients who are coming in with psych issues because they're already on certain medications which they're using for their health, like CHF or allergies or other endocrine disorders. So that kind of a software is used by physicians in order to know firsthand that what medications these patients were already taking, so they can be really cognitive about giving the dose of the psych medication and stuff like that. So I think,
It's a whole
and
different
all
level of
these,
ecosystem there.
yeah, the ecosystem is entirely different. It's like you use Android, you use Apple, and everything. By the way, this whole like experience I got from those rotations which were given, by these agencies. So
Mhm.
definitely you can use that, but the only drawback about these agency based rotations are sometimes you might end up with a clinic-based rotation with a doctor who is affiliated with the university, but practicing in a clinic. So
Oh,
sometimes you can end up with a poor quality rotation, and then once you enter the rotation, there's not pretty much anything you can do about it. So you need to be like, if you're even applying through these agencies, research about those physicians, like what
okay.
kind of experience you're getting. Maybe call up those agency people and ask them about the doctor. You can do that. You can definitely contact these people firsthand. So I think, yeah, that's how I would recommend. Like, first, take these agency based rotations, at least
Mhm.
one. Go there. You'll get an LOR. You'll get a letter of recommendation if you're performing really good. Most of the times you get. And then basically you just connect with a lot of residents over there, even the physician himself. You can ask him, like, I want to do a university based rotation, can you recommend me something? Be upfront, speak up, don't remain silent, because they don't like, they want your interaction, they want you to open up. They are also analyzing you because they have to write a letter of recommendation. What would they recommend if you don't speak up anything,
Yeah, they
right?
also like that if you are participating in the entire process, they will analyze this thing also.
Exactly. So that is important, I think.
Okay.
Yeah.
So, sir, how many like electives or this US based clinical experience are mandatory, like minimum numbers, like two, three, four?
I think basically there's no end. You can do how many rotations you want, but the cap, the 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 sweet average that I have found after my research is like, if you have five of those rotations, five of those observerships, four or five of those observerships, then it's pretty much enough in that sense. Nothing is enough. No one can tell you how many rotations would you need in order to match at this position, because it's random. It's like stock market. You're presenting your self to whole bunch of hospitals throughout the US while you apply. So
Mhm.
who knows what criteria each and every hospital want. But doing four or five good rotations where you can, at least if you can manage to get two letters from program directors,
Okay.
uh, that can be really good. In my journey, two of my letter of recommendations were from program directors. So I think that was also a good factor that helped me throughout the journey. So
So
make sure
basically,
you research about the physicians before you go for the rotations.
four or five US based clinical experience will give you in a sweet spot.
Yeah, a sweet spot. Like you can be ready to compete with the other candidates when you have
Mhm.
this kind of an experience. Some hospitals, they straight away say, like, if you'll go into a residency, like match a resident, or when you use residency explorer while researching about programs, you'll see that some prefer 6 months of USC straightforward, no jokes. Like, if you don't have 6 months of USC, don't apply to our program. And some will be even okay with two, some will be even okay with one, some will be even okay with none. But who knows what they need,
Yeah.
right? They, some of the times the information is also not updated on a lot of these websites. So like, calling each program is insane. Like, it's not possible. So have 20-25 of your top choice program, and then think about all those accessory programs that you might consider applying at.
Plan B, like plan B
Yeah,
stuff.
exactly.
Okay. All right. I am clear that how many rotations are mandatory, like not mandatory, like how many rotation are must, and
Yeah.
what is the journey of finding all these rotations. Because previously I thought that you have to contact different hospitals, different physician, and you have to mail them randomly that I want rotation, I want experience, I want rotation, and then somehow luckily they would respond, and then you will get a shot about it.
That is still in. I mean, you can still do that. That won't harm you. Like,
Uh-huh.
you knows what spot you get. Like, you
Yes.
can still keep, like, right after you clear at least one of your step, you can
Mhm.
start emailing all the programs that you have on your list. Like, see, University of Miami, sunny
Mhm.
upstate, downstate. Then you have Boston University. Then you have NYC Presbyterian.
Mhm.
You have University of Reno in Nevada. There are a lot of universities which, even if you go through the filters, you can find out. So a good trick for this is go to
Okay.
Residency Explorer tool, and put in your credentials.
Mm-hmm.
Like if you have your marks, put in your real marks, and if you are anticipating, then just put a figure. Create a profile. You have to put your step marks, your number of experiences, and stuff like that. And once you'll get a curated list of programs,
Mm-hmm.
the programs where you have the highest chance of matching, or the programs which have highest number of IMGs, you can open their website. So now you have like a concentrated list from Residency Explorer. You don't have to go in Google and just
Yes.
search random universities. So this way you can have a proper list of actual universities and go to their website and go to the student section, or like medical education section, and
Mm-hmm.
you'll find a coordinator's email, or you'll find at least some information regarding visiting medical students. That's the term they call it, visiting medical
Medical
students.
students.
Yeah. So the visiting medical student, you need to find that section and just email them, give your CV. Sometimes if you have IELTS score of English
Mm-hmm.
exam,
Mm-hmm.
it gives you an edge.
Okay.
It gives you an edge over other candidates. It's not recommended. I wouldn't say that give IELTS and then only you'll get the rotation. But if you have that in your hand, some
It is
people
a plus
have that.
point.
Yeah, it is a big plus point, because then they don't need to figure out that does this person really know English? Does this person, is really up for it? I think that would help more when you are left with your step two or both the steps, something like that. If you're
Okay.
done with both the steps, it doesn't matter, because they know that.
Hmm. Okay. Okay. So, sir, if, as you told that candidate can also use do this US based clinical experience after giving step one, and those clerkship when he was a medical student, he's a medical student, and another scenario is doing these electives after you are graduating. So, what is the like core difference between these type of two scenarios?
I think, see, clerkships are weighted way better than electives like externships and observerships. They come really low in quality. Clerkships are best. If you're a medical
The top.
student, you go there, yeah, they are on the top.
Okay.
And even sub internship positions are there. Some of the universities, they give sub internship positions. If you can get your hands on those kind of experiences, it's like you are a junior resident. You work as a junior resident in sub internship. So it helps a lot. I mean, these things like subai, clerkships, these both of these experiences are way superior than observerships. Some of the programs don't even consider observerships. They
Okay.
say straight away that we don't consider observership as USC. Some they do consider it. So it's like a dice. You need to decide that if you want to have four US clinical experiences, two of them would be
Clerkships.
basically observerships from really good universities. Like one of my observership was from University of Miami, Jackson Health System. So
Yes.
I think I received a really good letter of recommendation from that, because the coordinator was responsive, the students were responsive. Like I knew what kind of experience I had. So you need to trust your gut. Some of the rotations you just know. My first rotation was like this. I knew that I didn't learn anything from it, or very minimal from it. But yeah, it's a dice.
So we were at sir like as you told that minimum 4 or 5 electives US based clinical experience will get you in a sweet spot. So I want to ask you, sir, that and that to have different types of like sub internship, clinical, clerkship, and externships, observerships, and hands-on observership, as you told, hands-on. So
Yeah.
I want to ask that for particularly for me that if I have four of let's say four clinical US based clinical experiences, so how many should be like clerkship and sub internship, as you told that clerkship takes a highest point in that whole scenario.
I think it depends on specialty. Like internal medicine is a specialty where they'll require a lot of hands-on experience or at least an observership from a good university-based setting in internal medicine. In psychiatry, you might need more research than first-hand clinical experience. In surgery, also you might need a good mix of hands-on experience as well as a number of researches on your profile, publications on your profile. So I think there is no definitive answer, and that's why I think an average of four or like close to six, like 4, 5, or 6. Four is a sweet number. Like you can put in, like you can extend your CV a lot if you have four of those experiences, externship, observership, or something like that. But if you're a medical student and studying for step one, if you have cleared your step one, or even if you have not cleared your step one, when you're a medical student and you find an opportunity to do an elective as a clerkship, then you can definitely take that chance and grab that opportunity, because clerkships kind of like when you are training, when you are still in the training of medical school life, you are essentially, learning. You are essentially a good learner than
Yes.
someone who's a graduate.
Yeah.
So, and they also allow a lot of real hands-on stuff. They allow you to put on progress notes. They allow you to do palpation, like physical exam over the patient. They also allow you to interact a lot with the patient when you're doing your clerkships or sub internships. So clerkships and sub internships are really valuable in that sense, because they provide you a letter of completion, not just a letter of recommendation, but a letter of completion is also provided at the end, which is also valuable. Even if you're not considering the match, and if you want to practice in your home country, those letter of completions are really valuable, I guess. So let's say you do one or two clerkships, and then you're doing one or two externships, and a total of 4 or 5 experience you have in your hand. That is a safe spot. That's what I feel. You will be in a safe zone. But again, see, internal medicine is a specialty which might not be that heavy which might not have that high requirement for publications. But if you go into like specialties, like if you go in for ortho, you go in for dermatology, anesthesia, those specialties require some research work on your hand, like say 3 or 4 publications. That's how they would know that you're really interested for the specialty, right? Because you're directly applying for a specialty. You have an option in US of directly applying to these specialties. So they just want to be sure that they are choosing the right candidate, and to prove that, you can have, like, publications are the best way to prove it, because LORs are long. Sometimes LORs are also generic. You don't know if you're getting a personalized LOR or you're getting a generic LOR, because you waive, most of the students, they waive their right of looking at the LOR while you're applying to ERAS application. So I think having publications in hand, especially if you're a student, you are affiliated with universities, you can scoop into a lot of experimental studies and put your name as an author, do meta-analysis, do statistical analysis for the study. They'll allot you a specific position for that, or work for that. So I think, yeah, a good mix of 4 or 5 rotations and uh, 2 or 3 publications
Publications.
place you in a safe spot. Like, yeah.
Okay.